We use a lot of fancy terms in psychiatry, and it can be tough to know exactly what anybody's talking about. So I'm going to go over the definition of a few different types of psychiatry that you might see on someone's website or in the media, and then an analogy that might help drive it home and make it easier to understand. Conventional psychiatry aims to diagnose, so identify, and then treat what mental illness is going on, primarily using medications and therapeutic approaches. Functional psychiatry aims to identify the root causes or things that contribute to mental illness, like nutrients, toxin exposures, gut dysbiosis, other things like that, and uses targeted lab testing to identify those things and then personalize treatment recommendations based off of that. Integrative psychiatry will use conventional psychiatric approaches like medication and therapy and combine that with other modalities like exercise, nutrition, other lifestyle interventions to try to address the problem from multiple angles. Finally, holistic psychiatry, which is a little confusing because it's not a field in its own, but more so an explanation of an approach. Holistic psychiatry is essentially saying that someone is looking at you as a whole person and considering a lot of different angles in a less structured way than integrative psychiatry, but by no means less impactful or valid. And it takes into account a lot of the other things we spoke about, and also how spirituality or what meaning you find in life and that sort of thing plays in your mental health and wellness. To drive this home, we're going to use a house metaphor. If you're inside your home, apartment, condo, wherever you live, and the pipes burst or the electricity in a room goes out, you're going to want to have an immediate fix to address the leak or the electrical wiring so that you can continue going on and living your day-to-day life. But this is where conventional psychiatry can really shine in addressing the acute, severe, more immediate signs. Functional psychiatry is going in and looking at, why is it that these pipes keep bursting? Is there a lot of buildup from hard water? Is there an issue with the age of the pipes or how well they're maintained? Is there an issue with the foundation of the house? And attempts to address those things to promote long-term health and mental health and prevent things from recurring or continuing to get worse. And just like with a house, when you might have a plumber come in or an electrician come in to really look into the details and get an eye on everything, do some testing, functional psychiatry also uses testing in much the same way. With integrative psychiatry, you're going to address the pipes leaking, address the electrical wires having issues, and also think about other aspects, like, do we need water to be cleaner or air ventilation to be different? Do we need other angles of support to improve the overall health and efficiency of the home? Holistic psychiatry is like looking into the fact that the house isn't just a house, it's also a home. So what are the relationships like? What's the neighborhood like, the larger environment that's happening? What activities happen inside the home and how can we optimize it there? So looking at balance, connection, meaning, in addition to mental health. I'd like to finish out by saying that there is no one best type of psychiatry. Everyone's individual, so your needs are going to be different, and they might be different at different times or seasons of your life as well. So for some people, they might reach out to my practice and say, hey, I've been on this medication for a while, relatively stable on it, not really having major difficulties, fairly content in life. And for those people, conventional psychiatry or having their medications managed by their primary care is very good fit often. Other times people might be coming in and have tried a number of medications, but haven't had other aspects of their health looked into. And if spirituality, connection, loneliness is a major aspect, they might want to look more into, integrative psychiatry or holistic approaches that will take that into account as well. Or if somebody comes in and they're having a lot of systemic issues. So yeah, their mental health is struggling, but there are other things going on as well. And they may or may not have gotten a little bit invalidated by, different doctor's appointments or things like that, where people don't necessarily have answers for them, or the lab testing looks good and they can't find something obviously majorly wrong. That's when a functional approach is often good, because there's, pretty thorough investigation into the root causes of things that impact a person's mental health and physical health. But not everybody is going to need or benefit from that thorough of an investigation. Drop any questions or comments you have below, and I hope that you have an awesome week. Take care.
Serotonin, dopamine, the mind is more than can be seen. It's intricate, not just a mix of chemicals you need to fix. Listen in.